Okay, Mariala, we are live. Hello, everybody. Apologies for the technology issue that happened just now. I had to create a new event, and I hope the link got posted on LinkedIn. Uh, very sorry for this issue, but this is recorded, and it would be available on YouTube and LinkedIn after we finish for people to watch. Hi, Mariela. Welcome.
Hello. Thank you.
Is my voice clear enough for you?
Yes, so far it is. We will see later on because my ears get tired sometimes.
I totally get that. I
Hmm.
am going to try my best to talk slow
Hmm.
so that it's easy for you to follow my conversation.
Perfect.
Yeah.
Thank you.
However, if you don't understand one of the words or if it's getting challenging to follow what I'm saying, please
Hmm.
let me know. I can send you the message via chat and you can read my message and then reply.
Okay,
Okay.
no problem. Thank
So
you.
very happy to see you here after
Likewise.
so many messages that we have exchanged and email. Thank you very much.
You're welcome. Thank you for listening to my story a little bit.
Always here. So, this is before we start, I want to let you know that this session is getting recorded
Okay.
and it will be on YouTube and LinkedIn,
Okay.
posted as a recorded video once we are done. Do you consent to that? Once again, I'm checking with you.
I can say,
Are you
I'm
happy?
sorry.
Are you happy
Ah,
for the video to be recorded and for it to be on YouTube and LinkedIn?
yes, if this will be a help for everybody, of course, who
Yes.
is suffering
Thank
also
you.
with
I
it.
always like to make sure that I get consent again before we start going ahead with the assessment. Thank you for volunteering for this. I have no doubt this will be very helpful for a lot of
Hmm.
people. As you know, there are so many people who struggle with tinnitus,
Hmm.
hearing loss. You have experienced and you are struggling, so there's no one better than you who can understand what other people go through.
Mm.
Yeah.
Yeah, more than a hearing loss too is the tinnitus is so loud that that's why I cannot comprehend sometimes uh, the words or certain sounds. Uh, I My tinnitus is so complex that it's not just one ringing sound. It's what they call it polyphonic
Yep.
tinnitus.
Yep.
So
You
it
did
is so.
write that in your email. Yes.
Yes, that it's even louder than my voice, so that is difficult to um, concentrate for a long period of time, to have a conversation, or to yeah, to do daily tasks, not so much, but to concentrate to talk with somebody. It's really challenging for me right now.
Has that always been the case?
No, 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 no. This is since an episode of very severe hearing loss that I had in February last year.
Okay. February last year. Was
Mhm.
that before you got your cochlear implant?
Uh, that happened, yeah, the loud tinnitus and the multi-frequency tinnitus, it happened in February, and my cochlear implant was in May. And from there on, it has not been diminished. In the contrary, it has been getting louder and louder. Hmm.
Okay. Before we go ahead,
Hmm.
I think it would be a good idea that you give us a little summary of how your hearing loss started, how it has progressed, and how
Hmm.
did tinnitus start, how it
Hmm.
has progressed, when did you
Okay.
start using your hearing aid. Just give a little summary about it so that it's easy for everyone to follow what we are doing here.
Okay. When I was a teenager, around 15 years old, I was waiting for the bus to go to school, and I just fell down on the street. I just lost my
Oh,
balance and just fell down. I knew what was happening, but everything was turning around. So I had vertigo. And um, that happened 2 or 3 times. And so my father took me to the ear doctor, and they did numerous studies. And this was in 1992 or so, 1993. Um, After a series of studies, and the doctor diagnosed me with Meniere's disease. Um, but at that time, I did not have tinnitus.
mhm,
I didn't notice that. I have a little bit of a hearing loss, but also that was not for me a problem. I was
mhm,
starting seriously, professionally, be a musician. And the doctor says you need to quit that instrument and you need to stop what you're doing. Um, I didn't hear what he said, and I continued with my life being a musician. So I was medicated with a diuretic to control the
mhm,
balance problems, and
mhm.
I think it was lorazepam, which is some sedative or something like that to keep calm all the time.
Okay.
I did that for many, many years. Every morning I took that, every morning,
Every
regularly.
morning.
Every morning, yes, yes. And I have, the vertigo was gone. It was under control for many, many years until I was 30 some years old, that I started experiencing. I say, I will try to stop this medication. And I
Mhm.
started getting dizzy again, but dizzy, not having vertigo. So dizzy. And
Mm.
when I down, also, I was getting dizzy. So I keep taking the medicine up until today. I have everything under control. Vertigo is no more. So
Okay. So
if
that's
I would take,
settled.
yeah, so that's part, I guess that's part of my system. So I did not take the lorazepam anymore for many years, neither. Um, but yeah, I take that and multivitamins all the time. That's the only thing that I take. And I try to have a healthy life. I eat
Mhm.
very healthy. I don't drink. I don't smoke. So I think those things help to have a um, normal, good life, I will say. Um, During that time, since my teenage years until last year, let's say, my hearing loss was very, very, very progressive, very
Okay.
slowly through the years, but mostly through my left ear, because that's where I
To
was
your
like
left.
my left
Okay.
ear. So a few years ago, let's say 5 years ago, my doctor here in Germany says, I think you should use a cochlear implant because you're losing, this is almost 20% or 10% of your hearing that you have on your left
Mhm.
ear. I was using fully my right ear for absolutely everything, for music making. I have a very successful career as a musician, and so I have nothing to complain. I really enjoy everything, how I perceive sound in a way. It was full. It was fully. It's really, um, it make my life really, really happy. That's what I did since I was very, very little. So that up until last year, when I have periods of stress, in my personal life, I will say that's what exacerbated my tinnitus. It's like my head, my ears give up.
Mm.
Everything exploded on my head, I will say. And I have this rumbling sound in the bottom, this hissing sound all the time. I have like a musical tinnitus melody that keeps repeating every time. The goes half step higher and higher and higher until it goes super high and then goes back and start the melody again, higher and
There's
higher.
musical, sorry to interrupt, Mariella. There's
Mhm.
musical tinnitus. There's rumbling noise, did you say?
Rumbling like a track, park track. Um,
And the rumbling, the truck sound started only last year.
all these new sounds started last year because previously I had tinnitus, but it was only like white static noises too in
Mhm.
my left ear. That then it started progressively going to my right side.
Mhm. To the right
Right
side.
now, I
Okay.
have a different sound on my right ear, different sound on my left ear, something joint sounds in the middle, some in the back, some in the front. So it's a whole orchestra of sounds on my head.
I'm so sorry, Mariella.
I am too, but they
But
are,
I
I
I
call them
can
inner tea. I had to
I
make
can
them inner.
assure you, I can assure you that we will make it better.
Oh, okay.
I can assure you.
I
The
have
only
been
challenge is
living with
I
this
need
my
to
whole life.
understand it. Go
I
on,
hope
go on.
I can quiet them down. That's all I want. Like I make an orchestra when I conduct, I do like this to make them sound a little bit softer. Well, I want them down. I cannot calm them down. I do all kinds of things. I breathe as a horn player. I do breathing exercises and stuff, but it does not want to be quiet. Um, when I
I think
speak,
it
it's
needed
getting
Mini
louder.
Gupta. It needed Mini Gupta to tell it, you quieten down.
Okay.
No, look, I just need to understand the whole thing a little bit more
Okay.
because until last year, the situation was very different and then something changed. I
Mm-hmm.
want to understand what happened during the time when things changed last year. How were you feeling those days when suddenly, you said your head exploded and you felt there were so many different kinds of sounds. What exactly happened before, in the days before that, and during that time when you started experiencing it?
I have it's difficult for me to say, but I have stress at home, arguments, and that really got into my nervous system. And I guess that's what happens, stress.
Okay. Was that an unusual stress happening for the first time, or it was something that had happened in the past also, and this was just one of the other times?
It happens a couple of times, but this is yeah, I would say it was new for me, this kind of trauma.
Okay. During the trauma, was there any kind of sound involved or any exposure to noise involved?
No, but loud speaking.
Loud speaking.
Hmm.
Do you do you want to tell a little bit more? You don't have to tell what happened, but I just want to understand the level of the voice, whether it was a low pitched voice or a high pitched voice. What did you feel when you were hearing that loud voice? Were you covering your ears? Were you feeling scared?
Um, I was feeling, yes, I was doing like this. It was very, very overwhelmed, everything. I was feeling very um, afraid, I will say.
I'm sorry about
And
that.
after that, when I have all this sound and everything comes down, I had, I was very, very, very absolutely sad because I see that the day passed and I could not perceive the sound because the tinnitus is like, I wrote it down, it's like a pedal that adds distortion to the sound. And sometimes it changes the pitch. So when I hear music, I don't hear the real melody, but distorted and out of tune. So that's what tinnitus does. Also changes the sound. I know how a violin sounds. I know how a trombone sounds, and
Yes,
they
yes, of
sound
course.
totally different. It sounds very metallic, or the trombone sounds very. It's just a different sound than a natural
Mm.
sound. It
So
distorts.
do you mean that with the exposure to music or other loud sounds,
Mhm.
tinnitus reacts and changes in pitch?
Yes,
Okay,
any sound actually.
any
My
sound.
brain does not want to accept external sound. When I hear your voice, it's like a hammer. When I hear different things, like a hammer on my head.
Was that the case before the event happened last year?
No,
Hmm.
that was after my operation.
Oh, sorry, that was after the operation for the CI.
Yeah, correct.
Okay. So I want to confirm this. So the trauma that happened last year,
Yes, in February.
where in February,
Mm-hmm.
when you were covering your ears and you were feeling scared,
Mm-hmm.
did this sound sensitivity or feeling of hammer in your head, did that start
Yes,
around that time?
at that time. But then it calmed down. I had my operation and came back. Came back the same like February, but worse.
And what was the difference between time difference between you experiencing these symptoms, the hammer-like symptoms,
Mm-hmm.
and CI surgery? What was the time difference?
I didn't understand the question. I'm sorry.
So the trauma that you were talking about when you felt scared, when someone
Mm-hmm.
was yelling, that
Mm-hmm.
happened in February. Is that right?
Yes. Yes.
Which month did you get your CI done?
In May, I got
In May,
mm-hmm,
March, April, May. So 2 months,
3 months later. Two
three
months later.
months,
Yeah.
2 months. Between these two events, the
Yes.
trauma and the surgery,
It did
what
not
were
go back the tinnitus, but um, it calms down a little bit, but because I couldn't hear anything. Oh, I lost almost total hearing of my left ear, and I
okay.
lost a lot of hearing on my right ear.
Was that
And
suddenly?
this one I didn't need hearing aid or anything. So now, after the operation, it's like my brain is overstimulated or something because I have electrical input, acoustical input, and the tinnitus on top of that. And audiologists were telling me to keep using the implant that it, in many cases, the tinnitus reduces. And I have been trying that, but I could not do that because I have hyperacusis. And
So you
so
are aware that you have hyperacusis?
I do, because when I hear some sounds, it's like I said, like a hammer on my head. So or any loud sound, it's just I have a reaction to it. So this
Mhm,
is
mhm,
quiet right now and I'm fine. So, but if I go
mhm.
out to a place where there is some sudden sounds, loud sounds, I react immediately to it. Right? Do like this. So I have to be playing all day. Okay, now I rest from my cochlear implant. Now I use only the hearing aid. Now leave the hearing aid out, or I'll take them both out and stuff like that until I balance the whole day. That if I need to speak with somebody, I can be able to use both of them. Like this
Well
morning,
done.
I didn't use anything, just up until now that I can speak with you.
Well done,
Then
Mariella.
I have to
Very
take
well
them
done.
out.
Yes, I see where it's going. Now, just going back a little bit in
Mhm.
timeline. So February,
Okay.
the traumatic event happened. CI
Yes.
happened in May. When did the
Mhm.
sudden change in hearing happen?
When did the sudden change?
So suddenly your hearing went away in your left ear. Is that right?
I didn't understand the question.
Okay, let me just read it in the questionnaire that I had sent you.
Okay.
I've got the
I can
information here.
hear you. I just don't understand.
I apologize. It might be my accent. Okay, I don't have an answer here. I'm going to type the
Mhm.
message.
Okay.
So I'm asking, hi Mariella, when did your hearing get worse last year?
When did my
Okay, I've sent a message to you.
Oh, in February when I have that episode.
Okay, so it got worse
That's
in February when you had the episode, that
and
traumatic episode.
since then I could not play music again or make music or hearing music well again.
Okay, now going back to that to February
Mm-hmm.
again, February
Mm-hmm.
2025.
Mm-hmm.
Did the hearing go down before the traumatic event or after the traumatic event?
The tinnitus,
The hearing and tinnitus, yes.
it fluctuates. It's I cannot say it got worse. It can because sometimes it was a period of time when my right ear it got better, and my left ear, of course, I'm deaf, so because of the cochlear implant, I have no hearing there, and on my right ear, sometimes it's better, sometimes it's not. So right now is not very good because this new sound, and because it changes. I gave you a list of my tinnitus and the decibels and the hertz and everything, not decibels, the hertz that the different frequencies that I have, but that has been changed since August last year. So
Mariana,
it's,
I've just sent you a message in the chat.
mhm.
I've sent you a message in the chat.
Did your hearing get worse? Yes.
So
When I
while
am
that was
stressed,
happening, that's when your hearing got worse.
yes, yes.
Hmm.
It was a very
Were you
stressful
involved?
have. It was a domestic situation that I have,
Hmm.
um,
I'm
stress
sorry.
that I had. So that
Mariela,
happened.
if you do not feel comfortable talking about it, and if you do not
Mhm.
want to mention any details, that's totally
Okay.
fine.
Okay. I would just say that it
Right?
was very stressful, very loud,
Very
and
stressful.
it was for an hour or so, and that what causes the whole thing
Okay.
to go.
I have one or two more questions about this, but I'll ask that separately later, not
Uh-huh.
here at the moment. Yeah.
Okay.
So, so this is what I'm understanding that until February last year,
Yes.
you had hearing loss, you had tinnitus, but it was manageable. It wasn't bad.
Very manageable. Yes.
Very
No problem.
manageable, right?
Very
Yes,
manageable. I mean,
very manageable.
I made them my friend. I call it Mr. T. Mr. T is here and he's my friend and it's okay and I can put it back and ignore it It's okay. I know you don't like to say ignore it, but it's okay. It's when I'm paying attention to something, when I do something that I like to paint and put some music far away, that's not, it's not there.
Mm.
But and sometimes it was quite loud, but I knew what to do. After a concert, I play a concert, and yes, I have all the percussion behind me, the trombones and everything. I knew the next day I had to rest. I don't have to do anything. I don't have to practice. So next day I rest. The following day I practice, or I do my rehearsals or whatever. So it was very manageable.
So since February last year, it got worse. And is that why you got the CI? Because your hearing went worse in your left ear?
Yes, yes, and also because it was, I lost, I only had like 30% of hearing of my right ear. So I am very afraid that I will lose my hearing on my right ear and I will not be able to do any of that. I
Okay.
will not be able to
Now, a
hear.
very important question. Okay. Did you experience any physical injury to your head or to your back or to your neck in
No,
February?
no,
After February,
no, no
during the
injury in my,
time,
only operation
no injury.
on my cochlear implant. That's it.
Okay.
One
Uh,
interesting fact that has
yes.
nothing to do with it, my
Mhm.
right vision, my left vision, where the cochlear implant, it got incredibly better. I
Oh,
don't understand.
is that after the surgery?
It, I went to my ophthalmologist because I need new glasses, and I have really thick glasses on my left side. It was -4, and now it's -275, and she couldn't explain that.
Wow, I should make a note of that and find out why did that happen. But that's
I
a
got
good
a
news.
cochlear implant
Something
and I
good
can
there.
see better now.
So left eye vision improved. Okay, I've
Yes.
made a note of that. Okay, so that's something to be happy about.
Yeah, of course. We
Yeah,
we
yeah.
have to focus on stuff like that
We have to
too.
focus on the good things.
I do
Okay,
that all the time.
so the CI journey, the cochlear implant that you received for your left ear, did you
Mhm.
feel that was very
Yes.
rushed?
Did I feel?
Was all the, I mean, within 3 months from February to May,
Yes.
within 3 months, you got a CI for your left ear.
No.
Okay,
You
let me
mean,
type this for you.
please? A cochlear implant in May. Was the process rushed? Um, Good question.
I don't want to
I
put
don't
any
think it
new
was.
thoughts in your mind, Mariella. It's just only if you really felt it. You don't have to imagine that it was rushed. It's just something I need to know. That's it.
And I am not sure.
You are not sure. Did
I
you
am not.
feel that you understood enough about the implant before you got it?
Yes, that
You did. Okay.
I understood, and actually I was curious too, um, as a musician, to see how I accepted. I mean, I was, of course, I was the period of time from February until I got my operation. I was very sad, and I knew I will not perceive the sound like I used to on my left side. But in another way, I wanted to continue communicate with people. So if I can understand speech, that will be fine with me, and I accepted that. And but also, I was curious to see as a musician how I will hear this and maybe I can help somehow describing how I hear with my cochlear implant. I have to say that is it's kind of incredible. It's amazing. Um, because sometimes I have periods of time where I can understand the real voice. It comes out. It's not exactly the same, but it's pretty, technology is amazing. So that part, I always took it on a positive, look in the positive, you know. Um, I can hear, I can understand. Music is still not there. I know that music comes last, but my purpose was to be able to understand and to communicate.
That's very
So
positive. Yes.
for that reason, I'm happy to have my cochlear implant. What is stopping me from progressing is the tinnitus,
I'm going to make a
because
note of that.
it makes me so tired and so stressful that I have to stop practicing with my cochlear implant. If it's for me, I will have it 24/7 practicing, hearing and speech and doing the app things or
Okay, let's
music,
come
live
back to
music, whatever.
tinnitus. Let's come
But the
back to tinnitus.
tinnitus is in the middle.
Yeah, let's come back to your tinnitus now. I'm sorry if I interrupted you there. I want to make sure I get every detail from you because once we understand what exactly happened, we will certainly be able to help you with the tinnitus, right? Now, at the moment, do you have your CI on? I presume you do
Yes,
on your
I
left
have it.
ear. And do you
Hmm.
have your hearing aid on your right ear?
I have my hearing aid on my
Which
right
hearing
ear.
aid are you using on your right ear?
I'm sorry?
Which hearing aid are you using on your right ear?
Oh, do you need me to say the brand, or
No, no,
I can
just
show you?
is it behind
Okay.
the ear? Okay, all right.
I'm using a stronger one, not today, but I'm practicing this one also to
Why
have,
is that? Why is that,
because
Mariella?
this one is 6 years old and I'm due to have a new hearing aid. That's why I'm practicing with this. But this one seems to be a little bit softer. And in a situation like this, when my tinnitus is really loud, I use this one for now because this one seems a bit too strong for me, and it reverbs in my head with the lower frequencies. It's not agreeing with me so far. So
Okay,
I'm testing that hearing aid,
okay.
the new
Now,
one.
I need to do a little testing too now. Because you
Okay.
brought the topic of testing, let's do some testing.
Okay.
So, at the moment, just now, not what has happened in the past or what will happen in the future, we are not thinking about that. We are thinking
Mm-hmm.
about now.
Okay.
With your cochlear implant, with your processor, the cochlear implant processor on, and with
Mm-hmm.
your hearing aid on, at the
Mm-hmm.
moment, if I ask you how much is your tinnitus on a scale of 0 to 10, where
Mm-hmm.
10 is the worst and 0
Mm-hmm.
is nothing, where
Mm-hmm.
would you put it? What number would you choose?
9.5.
9. So that's out of 10. If I ask you individually for each ear, for right ear, at the moment, in your right ear,
Okay.
how much would you rate your tinnitus from 0 to 10?
On my right ear, 8.
8. And on your left ear,
9.
9.
And it's kind of like in the back, in the middle right now.
In the middle. Okay.
In the
Now,
middle.
can I get you to? Sorry, you were saying something about the back. Do you want to tell me about
Yes.
that?
Right. It's in my right, on my left, of course, but in the middle.
In the middle.
In the
Okay.
middle back, not in here or here. I don't hear, it's like, it's not in here, it's right here
Okay.
in the
Thank
back.
you. Thank you for mentioning that.
Mm-hmm.
Now, can I get you to take off your processor, the cochlear implant processor? Not
Yeah.
now, just listen first.
Mm-hmm. Yeah.
And after taking it off, I want to make sure you hear my instructions. So after taking that off,
Mm-hmm.
listen, just stay there for 15 seconds
Mm-hmm.
and tell me what's the tinnitus like out of 10,
Mm-hmm.
right? After taking it off.
It's the same, I will say, but I hear different sounds,
Different
extra,
sounds.
like a
And
waving.
what do you mean by same? What number would you give to same?
8,
Eight.
maybe 7. 7. Mm-hmm.
Thank you very much. Okay.
Mhm.
Now, how much would you give to your right ear?
With my hearing aid right now,
With yes, yes.
it's really loud, 9, because I'm having, I depend on my right ear, and so I need volume on my hearing aid. So that's why
Okay.
external
Now,
sound is a
can I
problem.
get you to take off your right ear? Yeah, the device.
Mm-hmm.
Just normally, you don't just how much, sorry, what would you rate your tinnitus in your right ear to be now? There's a message for you. There's a message. 10.
It's really loud.
Okay. Now, no, no, wait. Can I get you to put only your CI on? So can I get you to put only your CI on first,
Ah,
please?
okay. Mm,
Now, just
I don't
listen
like
for
it.
10 seconds. What's the tinnitus in the left
It
ear
it's
now?
very hissing. I don't like it. Yeah.
It's hissing.
Only my cochlear implant. It's
What
more
would be the
high
number? What's the number you would give it?
I cannot comprehend that.
Okay. Typing.
My cochlear implant works really well together with my hearing aid,
Yes, of
but
course. Yes.
alone,
Yeah.
not yet. What note
Okay.
would you,
What number would you give to the
what number?
tinnitus in your
Um, that's pretty loud, so I would say 9 also.
9?
Hmm.
Okay. Without CI, only CI is, did you say 9? Yes. Okay, that's interesting. Now, can I get you to put your hearing aid on too? Yes, please.
Okay.
Now, what is the tinnitus like overall?
It's okay. It's kind of the same, but because I can hear you, it masks it a little bit, you know.
Okay.
The sound of your voice or the sound of my voice, it masks. But if I speak a little louder, my voice resonates in my head. I want to say that, for example, mm, washing my hair, it's terribly loud. It's like nails on a falling on a sheet of metal, the water on my head. I hear everything close to me, inside, everything. When I chew, when I eat something, I have to, if somebody's talking, I have to stop chewing because I cannot understand the person who's talking to
Mhm.
me because of everything is loud here inside my head. And I'm
Hmm.
not sure if I'm hearing some veins or blood in here because it's very interesting. Sometimes I hear like I'm underwater, and it gives me a sensation of drowning sometime.
Hmm.
Have you ever heard of that? Because
I have, I
yeah.
have, I
Oh,
have,
okay. Because I feel
but
like this.
the patterns are there, but everyone's situation is slightly different, right? So the life situations and life circumstances is are different for different people, even though audiological and tinnitus perception and stuff may be similar. So that's what I'm trying to understand here. That even though
Okay.
I'm understanding, I think I've got an idea now what's happening and why your tinnitus is like this.
Okay.
But I still believe there's more to it than what we are understanding. That's what I'm thinking. What else could be going on? Okay, now at the
Okay.
moment, while you're talking, can I get you to tilt your head towards your left shoulder and just stay there and listen if it changes?
No,
Okay, the other side.
that changes a little.
So it changes on the when you are tilting towards your right.
It's kind of,
Does it get louder or softer
no, when it's tension, it's get a little louder. It gives
on
pressure.
the right side?
Yeah.
Okay, now stay. Don't,
But
don't, don't.
oh,
It may
sorry.
aggravate your tinnitus. It's all right. Okay, now come to the center. Come to the center. Now
Mm-hmm.
bring your chin forward, touch your chest, and stay there until I ask you to move, like this. Okay, does that change?
No,
No. How about if we go backwards? Did that change?
no.
No. Okay.
It changed
Can I?
perhaps in pressure when I do like this in the pressure on my head, but it does not change the sound
Okay, thank
of
you.
the
That's good
or
information.
the
Now,
intensity.
can I get you to open your mouth and
Mm-hmm.
keep it open for 10 seconds and listen and tell me if anything changes? Anything changes?
No,
No. Okay. Three fingers. Can I get you to put them in your mouth? Do you experience any pain here? You can take it out now.
no mandibular. No,
No pain. Any tightness?
no,
Do you ever experience any tingling sensation in your face or any numbness?
no.
No. Okay. How is your balance these days?
They are fine. No
That's totally
problems at
fine.
all. Mm-hmm.
Okay. Do you have any stomach related problems?
I'm sorry?
Any stomach problems or digestive issues?
Oh, no.
No. Okay.
I'm a pretty healthy person.
Good. We like that.
Except that I.
I just have to ask these questions. I'm sorry.
No, no,
Okay.
please, please.
Yeah. Yeah. So, any problems in your back or in your shoulders, like tightness or pain?
No. Although I have been very, very careful with my posture because this is an instrument that requires to have a weird posture, and horn players, we usually have a problem with this or with our lower
Hmm.
back. But no,
Hmm. But
no,
no. Okay. Any problems with your nose?
no.
Do you sometimes get a blocked nose, or does your nose run sometimes?
I have pollen allergies. I mean, in the
Okay.
morning I sneeze twice, but that's
Do you
it.
get a runny nose? Do you get a runny nose?
No, no.
No.
When I have this allergies thing, yes, but it's just for a few seconds.
Okay. Have you
Few
ever
minutes.
had any allergy tests done by a doctor?
I did. I'm allergic to pollen and dust.
You are allergic to pollen.
Yes.
Okay. Do you take anything regularly for the allergy?
No.
Any
It usually
antihistamine
pass.
given by the doctor? Sorry?
It usually
Any?
pass after a few hours.
It would go away.
Ye-
Okay. Now, when you lay down in the bed, you just have to say
Yes.
yes or no for this one. Okay. When you lay down in the bed, it
Mm-hmm.
can be during the day or during the night.
Mm-hmm.
When you're laying down and still not sleeping, do you suddenly feel like clearing up your throat? Or do you feel as if your throat is getting blocked with something?
No.
No. Okay. So now, very important question.
Mm-hmm.
Okay. Ask me to repeat or to type if you do not understand the question or if it doesn't come clearly. All right. So I noticed in your questionnaire that your nighttime sleep, which is an excellent news, by the way, I was so happy to read that, that when you sleep, your sleep is amazing and there's no problem at all, right?
I'm so exhausted at night that acoustically tired, exhausted, that I look at a couple of videos on my phone, and then the
Mhm.
third video is like, put them away, I'm ready to sleep.
Okay.
No problem for
Now,
sleeping.
yes. So when you're sleeping, of course, you take off your cochlear implant, you take off your hearing aid, they're not
Yeah.
on your ears,
Mm-hmm.
right? Is that right?
Yeah. Yeah.
Do you
I
have
don't
any
mind.
other sound playing around you in the night when you're sleeping?
Repeat that, please.
Is there any other sound playing in the room
No.
when you sleep
No.
in the
No.
night? No.
No.
Okay. Thank you. Now,
No
next
white
question.
sound, nothing. Mm-hmm.
Next question. Last night,
Mm-hmm.
yesterday,
Yes.
when you laid in the bed
Yeah.
for sleeping, did you hear any tinnitus when you were lying down on the bed?
Always. It's 24/7.
Does it get better or worse when you lie down on bed? Or does it stay
It's the
same?
same, and sometimes it's worse because it's very, very quiet.
Okay.
Mm-hmm.
Mhm. Have you ever noticed that your tinnitus is slightly worse or slightly better when you lie down in the bed? Or does it get better as you stay in the bed?
It does not get better.
No. Okay. If you wake up in the middle of the night to go to the
Mm-hmm.
toilet or for
Mm-hmm.
anything, do you
Mm-hmm.
hear the tinnitus?
Yes.
Yes. Okay. Is it usually louder or softer than what you sleep with?
Softer. Softer.
Softer.
Mm-hmm.
Softer. That's good. Okay. And when you wake up in the morning,
Mm-hmm.
do you usually hear the tinnitus first thing or does it come as the day starts?
As it starts, but it's progressive.
So
It's
it's
like
much better when you wake up in the morning.
it's usually. Sometimes I
Usually.
wake up and it's right. Ta-da! Good morning.
Okay.
It's
Okay.
it's there really loud, but usually it's calm. That's why I start my day not immediately. I wake up and I put my hearing aid and stuff. No, I do a few stuff. I get adapted to the sounds. I put my hearing aid in a very low volume, and then when I start a conversation, soft conversation, put the volume up. If I don't understand, then lastly, my cochlear implant if I need it. If I need it. The
Hmm.
tinnitus the tinnitus is always there and is always loud since February last year. Hmm? Uh, eh, It did not change. It slightly changed in volume, but it fluctuates. It's different sounds. Fluctuates all the time,
Yeah,
but it's usually there.
usually. So,
All
next important question. If I ask you to compare your tinnitus between early morning
mm-hmm.
and late
Night.
night,
Mm-hmm.
when do you think it's better?
In the morning is better. At night is very loud.
Is that a
It's
pattern?
bad.
Is that a pattern that you have noticed most of the days?
Yeah, that's every day.
Hmm. Do you get migraines, Mariella?
Sometimes I have headaches and I have to take something, but I usually don't take anything. I don't. That's something that has changed since I did something last. Oh, this is important to mention. Um, that was October. I went to China
Mm-hmm.
for a business
Mm-hmm.
trip,
Mm-hmm.
and I took the opportunity to have acupuncture
In China?
and in China by a mm, by a very well-known doctor does traditional and modern medicine. So I have
Mm-hmm.
acupuncture for especially for tinnitus in my
Mm-hmm.
right, and the hyperacusis was gone. It was
Okay.
gone, but it's back again since a couple of weeks ago. So that was October.
Hmm.
For a few months lasted. I stopped the treatment and it came back. So it lasted for a few months, no hyperacusis.
And that was in your right ear.
Yes.
Okay. Can you give me, can you tell me what did the practitioner do during the acupuncture? Where exactly did they do the
He put
acupuncturing?
3 needles on front here. He said that he opened the eustachian tube. I don't know how
Eustachian
to
tube?
say that. Yeah,
That's okay. That you can just say tube.
the eustachian tube, and he made me open my mandibular here, my mouth, and
Hmm.
in that hole that we have, he put a needle there, 3 needles
Inside the
here,
ear, he put a needle
in,
there.
not inside the ear. No, 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 no.
Oh,
Outside.
okay.
No,
Outside, yeah.
three outside. Huh?
Okay.
One in the back, in the front, and some in the arms and in the legs. But that's it.
Did he do any
Usually,
massages? Did he rub any muscles?
no. It did hurt after a while when he took it in a couple of hours. He said that that is normal. And I did 4 treatments, no, 3 treatments with him. And then in here, I continue 3 more treatments or 6 treatments. And I stopped because that hyperacusis was gone. Tinnitus was never gone, of course. And but that helped me with the communication, with the thing. But right now, it's coming back and it's worrying me a little bit. I try to calm down, not to worry, but at the same time, I cannot understand, and that worries me, and that it's a vicious circle.
I'm here to break the circle now for you,
Okay.
and we will do it. We will certainly do it. Okay, so when your hyperacusis got better in your right ear after the acupuncture,
Mm-hmm.
I know you mentioned the tinnitus was still there,
Mm-hmm.
but do you think the tinnitus improved? Did it become manageable after the acupuncture?
It became manageable because the hyperacusis was not there.
Hmm, smart, very smart.
Mm-hmm.
So
Mm-hmm.
I think you already know what's going on. We just have to put the pieces of the puzzle together. And
Okay.
that is my role here.
Mm-hmm.
Right? Now, I want to give you a little gist of what happens in the auditory system when the sound
Mm-hmm.
goes up. So, when the
Mm-hmm.
sound comes in, it goes into the ear canal. That sound pressure puts the eardrum into vibration. The vibration of the eardrum starts moving the little bones in the middle ear, and the
Mm-hmm.
movement of the bones in the middle ear transmits the sound from the outside to the inside, which
Mm-hmm.
is the cochlea,
Mm-hmm.
right? And sound from cochlea gets transmitted through the hearing nerve to the brainstem, and from there up to the auditory part of the brain or the auditory cortex, where the
Mm-hmm.
cortex understands what the sound is like and the meaning. Hmm? So, this is the auditory part, it's the sound journey. Once the sound is understood, the sound travels to the other parts of the brain, mainly the limbic part of the brain.
Mm-hmm.
Have you heard about limbic system?
I heard of it, but I'm not,
Okay.
of course,
Just just
don't know in
just
detail.
imagine limbic system, just imagine limbic system and a particular part in the limbic system called amygdala that is constantly monitoring the incoming sensory signals.
Okay.
And it can be your hearing, it can be vision, it can be, the smell, the touch, the how we
Mm-hmm.
feel in the environment. It
Mm-hmm.
constantly keeps an eye on it. If the sensory stimuli coming in is nice and not annoying, the amygdala lets go of it. It filters it out. It doesn't react to it because it thinks, I know this sound, this is safe, it's not going to do anything wrong to me. But the
Mm-hmm.
moment it hears something that is louder than what the brain likes, or
Mm-hmm.
if amygdala detects that the sound has caused an annoyance, it tags that sound as unsafe.
Mm-hmm.
So tinnitus, since whenever you have had it, the auditory part of the brain and the limbic system has always been aware that there is this sound coming up, which is not very nice, but I know it's not going to kill me. So I will
Mm-hmm.
just keep an eye on it. I'm not going to
Mm-hmm.
react to it.
Mm-hmm.
And then it prepares itself that if something changes with the ear in future, or if I hear more sounds that are not nice or that are annoying, then I'm going to start reacting to it so
Mm-hmm.
that my autonomic nervous system knows what to do to keep myself safe. This is what
Mm-hmm.
goes on in the brain,
Mm-hmm.
right? So one is you've had tinnitus all those 15, 16, 20, 30 years while you were growing up. And then I read your information that you had sent when you were pregnant. That time also your tinnitus had gotten worse for some time. Is that right?
My tinnitus was very manageable there, but when I was pregnant, you said.
Yes.
Yes, but the vertigo came back when I lay down. It started
Hmm.
everything to go around, and so I had to from my 6 months on until I gave birth. I had to be sitting down,
Okay.
sleeping
Okay.
with lots
Did
of
the
people.
tinnitus did the tinnitus get worse around that time?
No, no,
No. Okay. All
no.
right.
It was the most beautiful 9 months of my life.
Oh, how beautiful to hear that. Did the
Yes.
tinnitus get better during that time?
And after that, it was, I mean, like I said, tinnitus was there, but it was very manageable, very
Okay.
manageable.
Yeah. So all these years, the tinnitus was always there in the background, which means the
Yeah.
brain was always aware
No,
of it.
sometimes was present, but I was dominating.
Yeah.
I was
Because
controlling.
it was not enough for your subconscious or your fight and flight system to come in and to act on it, right?
Hmm.
Because it was manageable. You could use your own strategies, your cognition,
I
your
use a lot of
understanding,
strategy. Yeah.
right? Yeah. But there
Hmm.
comes a time, and which was February last year, there
Hmm.
was a traumatic event
Yes, I
which puts
cannot put that.
our, yes, that traumatic event puts our amygdala, which is the emotional part of the brain, in a very hyperactive state. right? Which means amygdala would react probably 20, 30, 40 times more to the same stimuli that it was not reacting to in the past when it's hyperactive. Hmm?
Yeah.
Is it okay? Is it okay for me to talk about it? Can I continue?
Yes, of course. I
Yeah.
mean, I want
Yeah.
to
Okay.
find out
Yeah.
how can. Yes.
Yeah. So you have a very clear memory of that traumatic event. That's what I'm understanding. And you still remember exactly what happened, that loud voice, the sound sensitivity. So, that event there, whatever it did, and I'll talk to you separately about that event later, not now, that traumatic event put a lot of stress on the auditory system
A
as well
lot.
as the limbic part of the brain.
Mm-hmm.
And it was associated to a very, very unpleasant event in your life,
Mm-hmm.
right? So,
Yes.
auditory part of the brain, limbic part of the brain, the autonomic nervous system, everything was very hyperactive, did not know what to do.
Mm-hmm.
In that moment, the amygdala probably hyperactivated and reacted intensely, and the tinnitus got worse.
That's
Plus,
exactly
your
what happened.
hearing also reduced. I still don't understand what happened there with the hearing, but we'll talk about it separately. So the hearing also changed. There was a traumatic event, significant stress on the system, and there may be a few more things which we still don't understand that happened and that changed the whole thing. So it changed your
Yep.
ear because the hearing changed, and it also caused trauma, which means it must have hyperactivated your limbic part of the brain, your autonomic nervous system also. So
Yep.
that, if it was happening for the first time, probably the effect wouldn't be so much. But
Mm.
we know for sure tinnitus gets saved in our brain as a memory.
Mm.
It's always a memory of traumatic events in our brain.
Mm.
So, tinnitus, when initially it starts, it is like a minor trauma. You know, what is this sound? I don't like it. I don't want to hear it. But because of our identity and the kind of person we are, we learn our strategies to manage it.
Mm.
So, the brain doesn't react so much. Then, second time something happens, the tinnitus gets a little bit more worse, but the brain thinks I can still manage it. And then
Mm.
one day comes when everything gets out of hand. The brain can't handle it. And then that red signal in the brain starts going. You know, in the ambulance, there's a light that glows. Imagine in your brain that light started glowing, and
Mm-hmm.
because it has to tell everything that there's danger, I'm not safe, I'm not safe, I'm not safe. That's
Mm-hmm.
still going on. It
Yep.
hasn't stopped, that light, right? And that
Yep.
light, that emergency signal, will keep the tinnitus going, right? That's
Yes.
the that's the reaction part of the brain. That is how the brain is reacting. But that's the after effect of what's going on in your ear.
Mm-hmm.
Based on everything, I have prepared a report based on the questionnaires that you had done for me. I'll read out to you
Mm-hmm.
after this. Based on everything that I'm understanding here, and I'm sure that wouldn't be anything new for you because you've already assessed that for yourself. So, this is what I have to say. Your auditory system is constantly overstimulated,
Mm-hmm.
which I think you've worked out already. It's
Mm-hmm.
constantly overstimulated because of the sound sensitivity.
Mm-hmm.
And when the auditory system is constantly overstimulated,
Mm-hmm.
it does cause reactive tinnitus,
Mm-hmm.
right? That's why sounds, loud sounds, even wearing your hearing aid can make the tinnitus worse because if your hearing aid is giving you too much sound, that also will make your tinnitus worse.
Correct.
So
Yes.
when I read your questionnaires this morning, when I was getting ready for this appointment, I that is what I had written in my diagnosis, that it's sound sensitivity causing overstimulation of the auditory system, perhaps happening because of uh, too much sound from the devices or from I don't know that, but overstimulation for some reason, and that is causing annoyance in the
Mm-hmm.
brain,
Mm-hmm.
which is adding to the the past trauma, the annoyance
Mm-hmm.
from the tinnitus, sound
Mm-hmm.
sensitivity. So everything together is causing a lot of fatigue for the
Mm-hmm.
auditory system and for the um, amygdala to manage. Plus, you are a musician,
Mm-hmm.
which means you constantly have to use your auditory system.
Yep.
What that does is, because you're a professional who's constantly using your ears to listen, that means you're constantly paying attention to the sound of your equipment,
Mm-hmm.
right? When our attention is focused on a particular part of the body, whatever is happening in that part of the body, that gets amplified. So I'm coming. I'm not going to say you don't play your horn. Never, never, right?
I will play sometime.
Yeah, no,
Not
you
yet.
have to play. And
Not now.
the aim is
I'm
the aim
I'm
is to bring you the aim is to bring you to a level where you can play your horn 8 hours a day and still feel happy without any tinnitus. That's the goal.
yes.
So because
Yeah.
your ears and your brain is constantly focused on sound, it was already in a very hyper vigilant state
Mm-hmm.
to monitor the tinnitus and sound sensitivity. And
Mm-hmm.
then the profession also demands hypervigilance, not hypervigilance, that's a good vigilance to sound. So, what's happening is there's a mechanism in the ear which is causing tinnitus,
Mm.
and then all the hypervigilance due to the overstimulation of the hyperactivity of the amygdala, everything that is
Mm-hmm.
happening in the ear is enhanced or amplified.
Mm-hmm.
Based on the acupuncture thing that you've told me, I do
Mm-hmm.
believe your musculoskeletal structures are also adding to your tinnitus.
Mm-hmm.
So tinnitus may not be just because of one reason. It may be coming from different points in the auditory system and in your body.
Okay. Okay.
So because you've got different sounds, there's one which was I've written here. What did that go? So you've got a wave-like sound, a high-pitched like music, and a
Mm-hmm.
rumbling sound. All
Mm-hmm.
these sounds are coming from different bits. All the tinnitus are different, multi-frequency tinnitus. One may be coming from your middle ear, the other may be coming from your TMJ, and of course, there's hearing loss. Usually, the ringing and the musical type of tinnitus, which is the music, comes from the hearing loss.
Okay.
But the
Okay.
rumbling,
So it all
the
come from the
rumbling,
auditory system.
yes, the
What about
rumbling noise.
the nervous system?
Yes. So, nervous system is not involved in generating the tinnitus.
Okay.
Nervous system is involved in reacting to the tinnitus,
Okay.
right?
But the one that
So the
is
reaction,
making
yes.
this sound is the nervous system. Okay.
So
Yeah.
imagine the sound when it's traveling from outside to the inside of the ear and going up to the hearing part of the brain. On the way, that sound is getting modulated or it's getting changed because of hearing loss, because of hypersensitivity. So by the time the sound reaches the auditory cortex where it gets processed, the sound has actually changed. The frequency, the characteristics of the sound changes, and the degree of sound that reaches the brain, that's also reduced because of the hearing loss. To compensate for this, the top-down mechanism of our auditory system, what it does is it thinks the sound that is coming up is not enough. So let me turn the volume up so that I can compensate for it.
Mm.
So the automatic volume control inside our auditory system, it doesn't
Mm.
look like a volume control, but it
Mm.
behaves like a volume control.
Mm.
So that volume control, it what it does is it turns up the neurological neural activity going on in the brain that comes
Mm-hmm.
from the brain to the ear. So there's one activity that happens from the ear to the brain, which is sound
Mm-hmm.
related activity. The other is from brain to the ear,
To the, mm-hmm.
right? And
Right.
that top down activity depends upon what's the level of the sound and what kind of sound is reaching your brain. So when the
Okay.
sound reaching up to the brain is modified by hearing loss, by TMJs, by sound sensitivity, then the brain has to compensate for it. So what it does,
Yes.
it brain thinks, oh, I'm not getting enough sound, so let me produce my own sound and let me compensate for it. So it produces
Mm-hmm.
those sounds because brain doesn't know, poor thing, that
Mm.
that the perception, the amygdala wouldn't like the sound. The brain doesn't know that. It just produces it.
Yeah.
So hyperactivity in the auditory system is like the volume control in the auditory system is turned very high.
Mm.
So we have to reduce that volume control. We have to bring it back to normal. Of
How do we do that?
course, we'll do that. Now, whatever we are talking about now, whatever information I'm giving you now, this is a therapeutic counseling kind of information because we
Mm-hmm.
are giving you an understanding of what's going on in your auditory system.
Mm-hmm.
So that becomes therapeutic because the brain is finally getting a logic behind the symptoms and
Mm-hmm.
it's understanding what happened. So, this information may help a little bit to start with,
Okay.
right? So, that volume control that is turned very high, we need to work on that. Now, how do we turn it down? The first factor is there is a hearing loss, and both the ear they are different, they are asymmetric, they are not same in hearing levels. And in your right ear, there is a hearing aid, in your left ear, there is a cochlear implant.
Mm-hmm.
So, as you said while you were telling me about your ears, that one side is getting acoustic stimulation, the other side is
Mm-hmm.
getting the electrical stimulation,
Mm-hmm.
right? But I want you to know in the inner ear, when the hearing nerve takes the signal from a ear to the brain, the sound first gets converted into an electrical signal,
Okay.
and then it goes up to the brain,
Okay.
right? Does that make sense?
Makes sense.
Yeah. So, cochlear implant is giving an electrical stimulation to
Mm-hmm.
your hearing nerve, and in the right ear, which is your better ear, the sound is going and that is causing the electrical stimulation. So ideally both the ears have got electrical stimulation.
Electrical stimulation. Okay. That
That makes sense.
makes sense. Okay.
Yeah.
Mm-hmm.
But the problem what is happening is the level of electrical stimulation in both the auditory systems is different.
Okay.
So there's a rule in tinnitus and hyperacusis, very important, especially in your situation. If there is sound sensitivity in the auditory system, and if we give amplification to the level where we normally do for people with hearing loss, that would cause more distortions in the auditory part of the brain.
Yes,
It will
I think
experience
that's what happened.
distortions,
Yes.
which means increasing the volume will cause distortions, will cause
In the
more annoyance, and that increase in distortion and annoyance makes
yep,
the tinnitus worse, which is your reactive tinnitus,
right.
right?
But if the volume is not up, I cannot comprehend the speech.
Yeah, I'm going to come to that.
Okay.
That becomes a problem. Yes. But the rule is, or the right way to think about it is, if your auditory system is already hyperactivated,
Mm-hmm.
if it's already not able to handle the sound that it's
Mm-hmm.
getting,
Mm-hmm.
giving it more sound will make it worse.
Yeah, that's why I take them out when I'm
Yes.
in the street
So
or
you
something.
have already worked out the strategies very well. I'm just here to
Oh yeah,
join the
I'm
dots for
doing
you.
different strategies every day
Yeah,
to
I'm joining the dots for you here.
okay.
So whenever there is hearing loss, tinnitus, and um, hearing loss, tinnitus, and sound sensitivity, when all
Mm-hmm.
these three are present together, the first thing that we need to target sound sensitivity, not the hearing loss.
Okay.
Because if the sound sensitivity does not get better, the ear will not be able to handle the amplification or the electrical stimulation that is coming from the ear.
Correct.
But we need the hearing also, right? It's look, I have done this a lot of times. But the biggest challenge is when someone has hearing loss with sound sensitivity, because there's no way we can give you the degree of sound that your ear needs to compensate for your hearing loss and still keep your ear without tinnitus. That will not happen. So, what
Mm.
we do is we compromise. We
Mm-hmm.
compromise on how much amplification we are giving you.
Right.
So,
They
the
have to listen.
amplification, yes,
Yeah.
this is where your local audiologist will come in handy. So, I will be
Yeah.
sending instructions what to do with your hearing aid and your cochlear implant, how to program it so that it can stop
Mm-hmm.
um, adding to the hyperactivity in the auditory system.
Mm-hmm. Mm-hmm.
So, what we normally would do is your stronger hearing aid that you showed me, the BTE before, please do not use that at the moment.
What is it called?
Your bigger hearing aid, the more powerful one,
I'm not.
do
Yes.
not use that. Do
Mm.
not use that. Okay?
Mm-hmm.
Not for now. There will be a day you may need it, but not in the present. That
Okay.
is that is a cross for now.
Mm-hmm. Mm-hmm.
It will make things worse for you.
Yes.
Okay? Not using that. The other hearing aid, the smaller one that you're using,
Yes.
that's good enough. But what I need from you now is yes, yes. What I need from you now is can you ask your audiologist to send me the settings of your hearing aid? I need to know how much sound or gain the hearing aid is giving you on different frequencies.
Mm-hmm.
That will be the first stage of the treatment, meaning
Mm-hmm.
I will send information as to how much gain to give on different frequencies and never
Mm-hmm.
going above that
Mm-hmm.
until we give a green signal that the ear is fine now to receive more gain,
Okay.
right?
Okay.
Now, along with the reduction in volume of sound that's going up, we have to do sound therapy. So the
Soundtivity.
sound therapy.
Therapy. Okay. Sound therapy.
Yeah. So what do
Sorry.
we do in sound therapy is we program a sound through your hearing aid, which is programmed according to your sound sensitivity, according to your hearing loss, and according to your tinnitus. It's not like there's a sound, you turn it on and off. No, it is
Mm-hmm.
programmed according to
Mm-hmm.
your ear.
Okay.
And that is something I cannot ask anyone else to do because that is very, very specific. It has to be done by someone who's trained in doing it. But,
Okay.
and that
How
sound
how
therapy,
will that work with somebody who has multiple frequencies tinnitus?
yes. So multiple frequencies of tinnitus could be, as I said, could be coming from your sinuses, it could be coming from your TMJs, it could be coming from something else too. And that is where I'll need to sit and make a plan for you as to what all you need to do. So the
Okay.
allergies that you
Mm-hmm.
have, the pollen allergies, what
Mm-hmm.
the allergen does from the outside is it creates a lot of inflammation in your
Mm-hmm.
nasal sinuses. And that
Mm-hmm.
inflammation can cause blockage of your eustachian tube, the tube that connects the
Okay.
nose to the ear. And that
But
blockage, yeah, go on.
yeah, I'm sorry. That's seasonal allergies because right now I'm not having that problem, and still tinnitus is right there. So
Yes. So tinnitus, your tinnitus is not because of the allergies. No,
no, no,
it's not.
no. Yeah. Mm-hmm.
Allergies can add another level of tinnitus to it.
Okay. Okay.
not directly, but
Mm-hmm.
indirectly.
Okay.
So if there's anything that changes the pressure in the middle part of the ear,
Mm-hmm.
or
Mm-hmm.
anything that changes the function of the ear, can cause
Mm-hmm.
tinnitus. Let's put it that way.
Okay.
And depending upon from where that cause is coming, the sound of the tinnitus is different.
Okay.
But very important, irrespective of whether your tinnitus is coming from your middle ear, whether it's coming from your inner ear, whether it's rumbling, whether it's music, whether it changes, whether it's not change, it doesn't change. Irrespective of all the factors, the sound therapy that we program based on tinnitus retraining therapy, that helps all the kinds of tinnitus.
Okay. I was
In
interested to
fact,
hear about that. Mm-hmm.
in fact, as soon as we program your hearing aid according to the sound sensitivity and reduce it, and we add sound therapy, as soon as we do that, the hearing also improves perception of
Oh.
sound, because
Mm-hmm.
the overstimulation of the auditory system is causing distortion.
Mm-hmm.
With the sound therapy, that distortion reduces.
Okay.
And because we'll be reducing the gain, that unnecessary sound stimulation that's happening, that will also reduce. So the reaction that is happening because of the hyperactivity, that reduces, which means the tinnitus reduces.
Mm-hmm.
That is for your ear, which is got hearing aid. Now your ear, which has got the cochlear implant, I will need to see what the map looks like. So is who has done the mapping for your cochlear implant? Is it your own audiologist, the local
Yeah.
audiologist?
My acoustiker here in German, she has been very, very helpful in doing lots of mappings, and she says overstimulation is not good, for you, Marila. So I'm trying a
Yes,
new
yes.
setting that we did a couple of months ago, and it seems to be working for me, although it's not in the volume that everybody will like, but this is what I need right now. A more comfortable way and
So
try
I
to use
want to
it
see the
as more.
settings.
Mm-hmm.
Yes, the comfort. So there are two types of levels in cochlear implants. One is T levels and one is C levels. T levels
Mm-hmm.
is the threshold of the electrical stimulation, and C
Mm-hmm.
level is like the maximum that your
Mm-hmm.
cochlear implant is giving you on different
Mm-hmm.
electrodes. So I need to see those settings. So can you please request your audiologist to send me the settings of your cochlear implant and your hearing aid? So
Okay.
based on that, I can give them feedback what to
Okay.
do with the hearing
Okay.
aid and the CI, right? Now,
Very good.
meanwhile, what to do? I need my paper back. Okay, so as soon as you removed your cochlear implant, your tinnitus had gone down to 7 out of 10.
My tinnitus has, well, yes,
So just
correct.
yeah. When I asked you to take off your cochlear implant,
Mm-hmm.
you don't have to take it out now. When you had
Okay.
taken it off and your hearing aid was still on, your tinnitus had gone down to 7 out of 10.
Mm-hmm.
Mhm. That is a direct indication that the cochlear implant is giving probably a bit more extra stimulation. I don't
Mm.
know. I haven't looked at the settings. I'm just guessing it.
Mm-hmm.
Because removing the CI, if it has improved the tinnitus, that means it must be something to do with the electrical stimulation or the levels of it. So we'll need to
Okay.
check the levels, right? And
Okay.
hearing aid definitely probably is giving you too much, because in audiology, we are not usually taught how to program the devices if there is
Mm-hmm.
sound sensitivity. So most of the times, the programming that is done by audiologists is without keeping the sound sensitivity in the mind.
Mm-hmm.
And that can cause a lot of trouble. That can cause annoyance, the resonance that you were talking about, the headaches, and that can cause annoyance at the back of the head. So a
Mm-hmm.
lot of my patients who have sound sensitivity related tinnitus, they've always said that they feel it here at the back,
Uh-huh.
most of them. And
Wow.
that's what you also mentioned, that it feels here,
Uh-huh.
right?
Okay.
So we have to get your settings looked at. We have to change the settings. So it's like whatever we give up, based on that will
We
come
need to
down.
bring it
So if
down.
we change what we are giving you, the tinnitus will also change, and it will change instantly. We do this all the time. The
Mm-hmm.
moment we change what we are doing with the auditory system, the tinnitus also changes. I'm not saying tinnitus will go away. I'm not saying that, but it will change. It will stabilize,
Yes.
right?
Mm-hmm.
Now, there are few other things that I want you to do.
Okay.
Even though you're sleeping very well, right, and the tinnitus is not bothering you, in
Yes.
the night, in the room where you sleep, I want you to use um, a music from YouTube, a natural music like waterfall, rain, um, beach sound, beach waves, any of these sounds. I want you to play in the room where you sleep at a very low volume, which is just
Okay.
enough for you to hear it.
Okay. Even if
We
I'm
have
not
to,
being able to hear it.
you have, so you will be able, you should be able to hear it.
Okay.
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 Now, how to get that done? Without your right hearing aid, can you hear anything at all?
Yes, I can. I can
Okay.
yes, I can hear. Mm-hmm.
That's it. That's what we need.
Mm-hmm. Okay.
Because in the night, your auditory system is experiencing complete silence.
Mm.
That's why the tinnitus is lower when you wake up in the morning.
Okay. I will try to do that.
But in the night, it's
Mm-hmm.
very important that your auditory system has a therapeutic sound in the background so that the automatic activity that is happening in the system that can
Okay.
reduce. So it's a therapy to
Okay. It
use
might be louder for
natural
my
sound.
daughter, I was thinking, but I will send her to another room and not
And
the
if
one
that's
next
a
to
problem,
me, but
if that's a problem, we can tell you the alternatives for that. But
okay.
starting
Okay.
today in the night, when you're sleeping, make sure you are not in a silent environment.
Okay.
We have to avoid silence.
Okay.
We have to avoid silence and we have to avoid overstimulation. We have to avoid both,
Okay.
right?
I
So in
wish
the
I
night,
silence.
sorry, say that again.
I wish I can hear silence. I never hear silence. There's never silence in my head.
Yes.
When I hear music, okay, a little bit, I can handle it, and then speech, and then, okay, I put everything down. I never hear silence, so
I know what you mean. And it is, but if I tell you this, silence is not very conducive for the auditory system.
yeah, okay.
It is not. People who have no hearing or
Mm-hmm.
who suddenly lose their hearing, they experience tinnitus because of the silence inside.
Mm.
So,
Mm-hmm.
silence is not very conducive. Our
Mm-hmm.
auditory system always needs a little bit of sound constantly going on,
Well,
just little,
there's always sound in everything,
right?
yes.
Yeah,
Yeah.
which means, so what level should you put the sound to? That's important. So, remember this, any sound that you use in the night should be at a level where you can hear it easily,
Mm-hmm. Mm-hmm.
and the level should be such that it doesn't interfere with your sleep.
Okay, perfect.
So you should be able to hear it clearly and it should not interfere with your sleep and it
If I
shouldn't be
sleep on
annoying.
my left side, because if I sleep on my right side, then I don't hear anything.
Look, in the night, how you sleep, we can't control, right? You
I
just do
change
whatever
them.
you can do. You just do whatever you can do. Put a sound, at least it will be better than total silence.
Okay, perfect.
This is a very generic advice, and actually anybody can use this advice. who's
Mhm.
experiencing tinnitus. Play
Mm.
a natural sound like a forest sound or beach waves or waterfall, raindrops falling.
Mhm.
These sounds do not use white noise and frequency compressed sounds and all. No, don't use them. Just the nature sound because they are very relaxing. They induce relaxation in the brain. So
Mm.
good. So in the night when you would be sleeping, your auditory system would be
Mhm.
actually fixing itself with sound going on in the background. See how
Okay.
simple,
All
right?
right.
It works very well. It
Very
works
good.
really well.
Try that.
During the day, if you do not use sound therapy, it's not much of a problem because there's already sound around you. It's in
Mm.
the night that things change.
Okay.
In the night, a nice sound in the background, which is nice and gentle. If it's there, it keeps the auditory system happy and balanced.
Mm.
So please start doing that.
For
And
me,
during the day,
different actually.
for you,
For me, it's
please let
different
me.
when I go at night because I'm so tired during the day. Auditorily speaking, I don't know if that is a word, but um, I go to sleep, and that's it. I forget until the next day.
Let me add
The
this
day
to
is
what you've just said. In the night, when you sleep, the only sensory system that is working is your auditory system. You are sleeping,
yeah
but the auditory system still works. It doesn't
continuous.
sleep. It doesn't sleep.
Okay, okay. I will do that then. That will be
That
one
is why,
change.
if there's a sudden sound, we wake up. Oh, what was that sound? Because auditory system keeps an eye on the environment to hear if there's a sound or not. Because if there's a sound, then I need to wake up and go and tackle the sound. There may be
Okay,
something which may harm me. So in the night, the auditory system becomes very hyper vigilant for everyone, for everyone. Mhm. So if it
okay,
is hyper vigilant, but there is a nice soft sound going on in the background in the room, that hyper
yeah,
vigilance will get a therapeutic sound, nice sound, and it will think, oh, why am I being hyper vigilant? Calm down. I don't have to worry.
okay.
It's all safe.
We're tricking then.
No, we are not tricking. We are not tricking.
My brain.
It's physiology. We are not
Okay,
tricking. It's physiology.
okay.
These are the mechanisms that are working in the auditory system.
Mm-hmm.
So many people, when they are in coma, they wake up and they report that they could hear things.
Mm-hmm.
How could they hear? They couldn't trick. They can't trick when they are in coma. Because
Mm.
even in different types of coma, people can hear the sounds because we know there's something called there's I can't remember the name of that little little part in the brain. So until particular part of the brain, the sound travels up, and after that, the sound. I'm probably not able to explain it very well because this is not my area. But until till a part of the auditory system, the sound travels even in someone who's in coma.
Hmm.
So that's why they can hear things, which means
Mm-hmm.
in the night when you're sleeping, even though
Mm.
you are not aware, you're not paying attention, the sound is still traveling up to a part of the brain.
Okay.
And if it experiences silence throughout the night because of the hearing loss,
Mm-hmm.
then it will think, oh, there's a problem. I need to fix it.
Okay.
And then it increases the volume of the tinnitus.
Okay.
That's why in the night it's very, very important to have a nice and gentle sound going on.
Okay.
And it should be at a level where you can hear it easily without needing to pay too much attention.
Okay.
You shouldn't be needing to focus on the sound to hear it. No, that's also not good. It
Okay.
should be easy
No,
for you to
because
hear the
as a
sound.
musician, I'm always okay. What is that song? And
Yeah. So
you
you
need
should be
to
able to hear it easily, and it should be not too loud, and it shouldn't be annoying, and it shouldn't
get
interfere
it.
with your sleep. I
Mm-hmm.
do that.
Okay.
So overall, the verdict is the sound sensitivity is
Mm-hmm.
causing most of your tinnitus.
Mm-hmm.
And I do believe the musculoskeletal structure is also adding to it. I'll make a
Mm-hmm.
plan and I'll send it to you. And
Mm-hmm.
I think the nasal sinuses are also adding. So I need you to do some testing to actually
Okay.
see what is the level at which your ear starts getting annoyed by the sound. So I want you to go to your audiologist and tell them to do the testing for your right ear,
Mm-hmm.
where they'll have to measure what is the maximum level of sound your ear can tolerate in the right ear. So it's called
Okay.
uncomfortable loudness level.
Mm-hmm.
Uncomfortable loudness level for your right ear for all the frequencies. That's what
Mm-hmm.
we need because that will help us to program the hearing aid.
Okay. And
And
for the
I looked
complex,
through your yes, I looked through your audiograms, the test results that you had sent me. I couldn't see anywhere the test for the middle ear, the pressure test.
yes.
So tympanometry, I'll type it for you.
Okay.
Tympanometry is what I want your audiologist to do. Tympanometry and the uncomfortable loudness levels.
Yeah, I have that. I think I sent that to you. Didn't
I
I?
couldn't find it, couldn't see it anywhere. I'll look again maybe.
Okay. Okay, I will
That's
send it
okay.
to
I'll
you.
look again and I'll get back to you. I'll check it one more time. Now the report that I did for your from your questionnaires.
Okay.
So there was a questionnaire for your tinnitus called Tinnitus Functional Index. We calculated the scores from it. Yeah. So the score on tinnitus functional index total is about 73, which means the tinnitus is having a severe impact on your life. We are not surprised. We knew it's having a, pretty bad impact. Now, this questionnaire will help us to monitor whether your tinnitus is improving or not.
Okay.
Mhm. One very interesting um, summary that I've seen from there is that the sleep is having only minimal interference on your tinnitus, which we discussed already. And the maximum interference is coming from your hearing. So
Okay.
the auditory component of the questionnaire has got the maximum score, which means it's the auditory system, a mechanism in the auditory system that is adding to the tinnitus maximum. If that
Okay.
settles, the emotional reactivity, cognitive stuff, everything will settle.
Mm.
If the ears were not struggling, or if the ears were in complete balance with your devices and everything, the score in the emotional part of the emotional score, or the what score we have here, the loudness score, the cognitive interference score, those scores would be much higher than the auditory score. But here the auditory score was 100 out of 100.
Mm. Okay.
Right, most of the
Okay.
time when we see people who have normal hearing and bothersome tinnitus, their score in the auditory domain would be 0 out of 100, but for emotional component would be like 90 out of 100. For cognitive interference will be like 80 out of 100. For social stuff will be like 70 out of 100. There, what it tells us is the tinnitus is coming more because of the reaction from their limbic part
Mhm.
of the brain.
Mm.
So
Yes.
I could clearly see that you are doing very well as a person. You're doing extremely well. You should be proud of yourself. I mean, with so much going on, you are still managing it very, very well.
Yeah, while we speak during the whole time, it has been doing some screaming once in
It's
a while. It's like,
despite that,
pay attention to me. I'm not. It's
despite
like,
that, you're doing very well, which means the reaction that your autonomic nervous system is having towards the tinnitus, that's still under your control, which is very good. That means once we fix the ears, once we bring the ears to a balance, things will improve.
Mm.
The challenge is when the reaction is too much, because then it takes a while to change the thoughts, the patterns in the mind, the fear, and all those
Mm.
things. Now,
Yeah.
so the next was hearing handicap inventory for adults. And the
That I
score
didn't
that
know.
we got. So this questionnaire tells me what is your perception of your hearing problems?
Oh,
How
okay.
much how much handicap it's causing, right? So
Mm-hmm.
the score that I've got is 46 out of 100, and that means the hearing loss or your hearing challenges is having a substantial impact on your hearing difficulties related to your emotional and social functioning domain. So
Mm-hmm.
hearing difficulties or auditory problems, it can be tinnitus, sound sensitivity, hearing loss, is affecting the emotional and social functioning. That's what
Mm-hmm.
it tells us. If
Mm-hmm.
the score was low here, that would tell me, oh, the score is very low, which means you're not experiencing any auditory system problems, and
Mm.
it's the function is normal. If the auditory
Mm-hmm.
function is normal, the score
Mm-hmm.
of this questionnaire will be very low. But if the auditory
Mm.
function is affected, I'm not saying
Mm.
hearing, I'm saying auditory function. If the auditory function is affected, the score would be high, and yours is at about 46, 47 mark, which means it is again the auditory function. So both the questionnaires, what you have told me, what I've understood, it's all pointing to the same direction.
Mm.
Mhm. And
Okay.
then we did hyperacusis assessment questionnaire, which you had filled
Okay.
for me. The total score was 29 out of 56,
Okay.
mhm, which is moderate degree of hyperacusis, which is quite high.
Mm-hmm.
So the scoring between 28 to 35 on this questionnaire indicates moderate sound intolerance, moderate kind of sound sensitivity, which is
Mm.
quite a lot.
Yeah.
So, and then we did another questionnaire that was to check misophonia. So
Mm-hmm.
misophonia is when the brain, when there's no problem in the auditory system, but because of
Mm-hmm.
the fear in the limbic system, it reacts to sounds. But that's
Mm-hmm.
not there for you. It's zero.
Mm-hmm. Mm-hmm.
It's zero, which is a good news,
Good.
which means your limbic system is not hijacking your auditory system for these soft sounds in the environment, like someone's chewing sounds, repetitive sounds. That can be very debilitating, but that's not
Yep.
there at all. It's
Yep.
zero.
Mm-hmm.
So, everything that we have done, the assessment today, after speaking to you, the question is that you have done, everything is pointing out towards the auditory system. The auditory system is experiencing dysregulation despite all that you have done for yourself.
Mm.
Mhm. But
Okay.
I want to make sure you understand, don't feel guilty about anything. There's no one to be blamed here. Hearing aid giving more sound or CI giving more sound, it's no one's fault.
Okay.
Okay, because this is a very, very special skill.
Yes.
It takes
Yes.
years
I
for us to
understand. They
understand
have
this.
been very, very they have been very, very helpful to me. I mean, they
Yes,
really try to work with me with this,
yes,
but I also feel bad because it constantly changes. That when I go to another fitting um,
yeah,
or a mapping, it's totally different from last time. We have to
yeah.
redo the whole thing. So yeah, yeah. But what they have been
So
understanding
I will be the
that
middleman for you.
need I need less stimulation in my
You
brain.
need you need mini. You need mini. Yes. I'll become the middle person. You are
Okay.
trying your best. Your audiologist is trying their best, but
Mm-hmm.
still the outcome is not happening, which means
Mm.
there's a gap in understanding. There's a gap in something, and
Yeah.
that gap gets filled uh, by using someone's skill who's worked in this field, because it's a very complex thing, and this is not
Mm-hmm.
something that we are taught. This comes
Yeah.
from experience and from learning.
Mm-hmm.
Um, so hearing loss causes tinnitus. We know that. But
Yes.
it's not as simple as hearing loss in your case. There are few things happening, which is a good
Hmm.
news because when it's this, we can easily handle it and make it better.
Okay.
I know it may be
Yeah.
sounding a bit
I,
unbelievable at this stage.
I believe that. Yeah.
See, you're
Yeah.
believing so quickly. Your tinnitus will change very easily. I believe that.
I I it I will get better. I don't know how yet.
Look, I
So I'm
believe you
not.
are still better. You are doing, you are it's just a part of you. It's just a little part of you that is overstimulated. It's not you. You are already better. You are already doing very well. You've gone through a lot. Despite that, in a new country, having children, you're managing so well in your life. What better can
So
we
many things
expect?
happen. Yeah.
Yeah. But there's a part, right? There's a part of it that is experiencing difficulty. And we'll treat that part of you.
Okay.
But don't believe that you are not doing your best or you need to get better. You are the best already. You just need to make your ear better.
Okay. Yes, that's. I agree with that. Yes.
I like it when people agree with me. Okay, I think that's enough. You must be tired too from all the listening. Thank you for sharing your story and for being so open to share
Mm.
everything. Um,
You froze for a little bit. Hello?
Hello, I'm back. Yes, I think the time is
Okay.
running out. Yeah,
Okay.
so
Okay.
send me the settings and we'll
Mhm.
take it from there. All right.
Okay.
You
Well,
look after yourself.
um, and I will be eager to find out if there are some more musicians, especially classical musicians who have this type of tinnitus, to get in contact with me or with you, whatever, to share
If
our
any
stories.
musicians
We,
listening or they are watching on YouTube, Mariella is there on LinkedIn. I'm there on LinkedIn. Or you can put a comment here and I can always put you guys in touch. And maybe you all can create a support group for each other.
yep, that would be great.
Yeah. Thank
Yeah.
you very much, Mariella. I really appreciate this.
Thank
I'm
you.
sure this is going to help a lot of people just to see, because there are
I
a lot of
hope.
people who contact us for telehealth, but it's difficult for them to understand what can you do with telehealth, you know?
Yeah.
So this is what we can do.
Mm,
We become the gap. We fill in the gap for you between your
mm,
audiologist and you. Based on what you tell me, I will give you my recommendations. And you don't need me to do that. You can go to your audiologist and they can help you out. You just need the
mm,
recommendation bit, which is what I
mm.
will be sending you. And we may do another session offline in a few days' time because I want to understand what happened in February, which
Yes.
wouldn't be appropriate for here probably.
Yes.
So I'll keep it. I'll stay in touch and we'll schedule another appointment. How do you feel about today, by the way?
How do I feel about?
What do you feel about today? Is there
Oh,
something
today. Well,
you
it
think it has
it
been
has been,
helpful at all?
I think it clarifies some things that I already kind of knew regarding. I did not know about the uh, mm, or maybe I did know, but I did not think about it. To at night, to keep doing having this continually
Sound.
active, and that's something that I will start tonight right away, and see what happened, how I wake up the next day, and I will try it for a few days and see what
Okay.
happened. Yeah.
I have another last suggestion.
Okay.
Instead of monitoring the tinnitus every day, I want you to monitor the sound
I You cut off a little bit. Mm. Are you there? Or just by myself? Mm, mm, let's see here.